Research shows that the best practice for cognitive therapy treatment is to do a functional-based approach. Whenever I am treating my patients, I will make sure that whatever I'm doing with them is actually going to transfer to their real life skills. At the end, I'm going to share a couple things that are really good for high-level patients as well. Number one, I talk about meal prepping, specifically like this. I will have a patient write out a couple meals for their week. What I will do is I will begin by writing dinner meal plan. I will put a few days of the week depending on how high level they are. If they seem like they are very proficient and efficient and that they could do this task well, I might do Monday through Friday. If they really need a lot of structure and help, I will just give one meal. I will say on Saturday night, tell me what you are going to have for dinner. Once they write out what they're going to be having for dinner, I go and I ask them to write a corresponding grocery list. So if they wrote down that they are having spaghetti on Saturday night, I want to see that they know how to plan out that meal. I want to see that they have spaghetti, meat, sauce on their grocery list. You can make this easier by having them just dictate it to you orally, or you can make it harder by giving them more categories. For this patient, I wrote out meat, dairy, produce, other, and I wanted them to put the grocery items they needed for their meal into the corresponding categories. Number two, doctor appointment details. Most of the patients that we are seeing have an upcoming doctor appointment. If I am able to get my hands on the information for when their next doctor's appointment is, I will use that. If not, I will dictate a made-up doctor's appointment. First thing, I would give my patient a pen and paper, and I would tell them about an upcoming doctor's appointment. I would include things like a location, the doctor's name, the reason for the appointment, the time of the appointment. I can make this more difficult by not having them start to write anything out until I am done giving them all the information. I can make it easier by writing out all the information myself and then asking them to identify things like location or asking them to tell me who is the doctor. If I am familiar with the area that I am working in, I will often follow this up with asking them about how they will get to the appointment. I might say something like, if the doctor's appointment is at 1 p.m. and it's in the downtown area, what time would you leave your house to get to this appointment? In that situation, I am talking about problem solving, but I am giving them an opportunity to bring in their real life situation into therapy, and we can talk through some problem solving in that way. Number three, I might help them contact their family. I always like to check in to see if my older adult patients know how to use their cell phone. If not, that's a really easy but functional area that we can help them target. A lot of patients who say, I do have a cell phone, but I don't know how to use it. I can help them by finding out what their family's phone numbers are. Within sessions, I have called family members or had a patient demonstrate to me that they are able to contact their son, who is their primary caregiver. I will even let that phone call ring through, and oftentimes the children might answer, and I just will speak, or I will have the patient say, hey, this is speech therapy. We are just practicing being able to call you. The patient's family is usually very receptive to this. They often thank me for helping their family member be able to make this phone call, and they say, hey, call again, no problem. To make this easier, I would write out a family's phone number in large letters and see if the patient is able to use alternating attention to look from the phone number to their phone and be able to make a phone call. To make this harder, I would have the patient program something into their phone, like a family's phone number, and be able to show me that they can access and contact their family if they need to. Number four, you can help a patient create a memory log. This is really beneficial, especially for someone who has some sort of diagnosis where we know that their memory is going to be declining. I have never been at a facility who won't be able to provide me some sort of binder or at least a folder. You can just type in memory log online. You could do this for daily activities. I will even have patients sometimes write out what they've done hourly that day, just so they can begin this habit of keeping track of things. I would include in this binder categories for their other therapies like physical therapy, occupational therapy, and speech. There could be a place for a visitor log, so who came to see them that day. I often have patients say, I really want to be able to remember what I did today, but I just can't seem to keep track of it. That's when I will turn to the strategy of writing, and I will have them keep track of what they are doing that day. Within my session when I am with them, what I am targeting is that writing component for a memory strategy. So while I am in their room and providing them this memory book, I am saying, I want you to write down right now what I am doing with you. What that sentence would look like for them, or what their note would look like, is I would give them my name. I would talk about what we did. So I would say, and what time we did it. So I would say, write down Grace, 8:30 a.m. speech therapy. Just a quick note so that when their family member comes later, they would be able to tell them, oh, this is what I did today. Number 5, review a facility activity calendar. Most of the places that I go to, if we're in something like a skilled nursing facility, oftentimes these places provide activities for the patients so that they don't get bored, that they can participate in social interactions. I will provide to the patients this activity calendar, and I will say, let's find 3 things for the month that you would like to attend. And then we can talk through problem solving of how they can get there. If there is a nail appointment at 1 p.m., but you usually take your naps in the afternoon and you want to do both, what time will you plan to rearrange your nap time so that you can attend this event? Just looking at, are they able to read and look at a calendar and understand the events? Number 6, I will have them write out a check. I always ask the patient first if this is something that they do in their real day-to-day life. If I have someone who says, I haven't written a check in 30 years, I'm not going to have them do this. But here's an example of what I did with a patient. She was in the hospital for something that was unexpected, and she was telling me about the bills that she was going to have come due soon once she got out of the hospital. So what I did is I had her write out what her rent was, her electric bill, and this was some other bill that she had. She gave me a total. What I then did is I just wrote out a fake check. So I made sure to have the date, who she was going to pay it to, the amount, the memo, and the signature. And I had her fill in the categories. This is a skill that she's going to have to return to, and maybe this has become a little bit more difficult for her. So again, I'm looking at things like alternating attention. Is she able to look at her budget and transfer that information to a check? I'm looking at memory. Can she remember the amount that we discussed that she's supposed to put on here? You can make this more difficult for a patient by giving them all the information and then having them begin to write. You can make it easier for a patient by just giving them one piece of information at a time and having them transfer onto the paper before you move on to the next piece of information. I wrote this one out on myself, but it's really easy and probably actually better for the patient if you can just print off a check, like a blank check PDF for them. Things for my higher level cognition patients, people who maybe need a little bit less intervention but could still benefit from some strategies. Number 1 is I like to have them to-do list. A lot of times if I'm seeing a patient in skilled nursing or in a hospital, these might be patients who are going home soon or who are going back to their assisted living facility. And there's always something to do, whether that is get more food in their fridges, make sure that they're able to attend their doctor's appointments, schedule transportation for an upcoming visit. These are things that need to be on a to-do list. And so within my session with that patient, I will have them write out a to-do list so that they are able to demonstrate the ability to use writing as a memory strategy. I would also be looking at if they can tell me the order in which these tasks need to be completed. So maybe sending the check for an electric bill that's due in 2 weeks is lower on the priority list than getting food in your fridge so that you're able to eat the next day. Second thing I would do for higher level cognition patients is I might print out a very simple article on things that are good for brain health, maybe 5 things that are good for brain health, Or if I only have, let's say, 30 minutes with them, I might do a shorter article that talks about things that they can do for their cognition. And then I will ask them to highlight the things that they think they can do to improve their own cognition. And then I would leave that article with them so that they have that resource. If we've created a memory log, I would have them put it into their memory log. So again, they're able to keep all their resources in one place. The big overarching thing to remember is keep the therapy about the patient. If they are telling you that they are not going to use something in real life, do take that into consideration. There are times when patients come in and perhaps they didn't need to write out a weekly meal plan before they came in, but as a strategy, because they've had a brain injury, they might need to start employing that. So I do try to counsel them through that situation. A couple of resources that I would suggest for speech pathologists is the podcast Speech Uncensored and the podcast Swallow Your Pride. That one is usually more about dysphagia, but there will be some cognition components sometimes in that as well. I would also suggest the website for the ASHA Practice Portal. The Informed SLP has really good article and research reviews for speech pathologists. And last but not least, my very favorite resource for cognitive therapy approaches is Honeycomb Speech Therapy. Sarah Barr, who is a speech pathologist, runs that site, owns that business, and she does a great job with providing free and some paid for resources. If you enjoyed this video, I really appreciate you sticking around till the end. Please subscribe. I would love to continue to make these videos so that I can help patients and families and other speech pathologists alike, as we are all trying to do the best for the people that we love and care about. I will see you next time.